What is rheumatoid factor, RF, and how does it affect Ra? Imagine your immune system as your body's defense team, always ready to fight off germs and infections. But sometimes, this team gets confused and starts attacking your own body instead. That's where rheumatoid factor comes into play. Rheumatoid factor is an autoantibody, which means it's an antibody produced by your immune system that mistakenly targets your own proteins. Specifically, RF targets a part of another antibody called immunoglobulin G, or IgG for short. Normally, antibodies like IgG help protect us from infections, but RF binds to these healthy antibodies and forms immune complexes. These complexes can set off a chain reaction that leads to inflammation in your joints and tissues. In people with rheumatoid arthritis, about 80% have rheumatoid factor in their blood. This makes RF a useful marker when doctors are trying to diagnose the disease. When RF levels are higher, it often indicates more severe joint inflammation, more damage to the joints, and a greater chance of long-term disability. But it's important to remember that RF isn't exclusive to rheumatoid arthritis. It can also be found in other autoimmune diseases like Sjogren's syndrome and lupus, in chronic infections, some types of cancer, and even in healthy older adults. So, having RF doesn't automatically mean you have rheumatoid arthritis, but it does give clues about how the disease might progress. Now, let's talk about how RF actually influences rheumatoid arthritis. When RF binds to IgG antibodies, it forms immune complexes. These complexes activate a part of the immune system called the complement system. Activation of this system leads to the recruitment of immune cells like macrophages and neutrophils into the joint tissues. These cells releases chemicals that cause inflammation, swelling, and pain. This process is a big part of what causes the persistent joint inflammation seen in Ra. RF also plays a role in sustaining the autoimmune response. The presence of RF-positive B cells, which are the cells that produce RF, suggests a more mature and ongoing immune attack. These immune complexes can create a feedback loop where tissue damage from inflammation stimulates more autoantibody production. This cycle keeps the inflammation going and can lead to joint destruction over time. For those living with rheumatoid arthritis, RF levels can provide useful information. Doctors often include RF testing as part of the diagnosis and ongoing monitoring. While RF positivity can indicate a more aggressive form of the disease, it's not the only factor doctors consider. Some people with Ra may test negative for RF but still experience active disease. Managing Ra involves controlling inflammation through medications, lifestyle changes, and regular checkups. In terms of the long-term outlook, higher RF levels can suggest the need for more targeted or aggressive treatment to prevent joint damage. But every person's experience is different, and treatment plans are tailored to each individual's symptoms and health status. Managing Ra is a complex process, and RF is just one piece of the puzzle. Always consult with your healthcare provider to understand what your RF results mean for your specific situation. Remember, understanding how your immune system works helps you better manage your condition and stay proactive in your health journey.